This is the RT300 device. The patient right now is using it specifically for the arm, but we can also do it in seated, standing, as well as we can attach the parts for the leg as well. We use it to facilitate the active movement of the arm where the nerve is not working, and also have a weakened muscle so the patient cannot actively make the movement. The electricity contracts the muscle to facilitate the movement. We typically use it for the central nervous system impaired patients, such as a stroke, multiple sclerosis, or the spinal cord injury patients. Compared to other electric devices that we have, this one you can attach to not only one small body part, but also other body part, including the shoulder, biceps, triceps, and other hands and wrist body part as well. So we can facilitate all the muscle to work together. One thing I like about this machine is it shows how much that each arm is contributing to this exercise, so that it makes sure that the healthy arm is not doing all the work.